I have not.
Not specifically.
Roundworm, yeah. Just that it's usually like transmitted through eating poo, like different types of poo outside.
I don't know anything about them. I do know that you're supposed to protect against them.
Keeping him from eating poo or unnecessary things like trash outside. And then anytime he's feeling down, we always go to the vet, make sure he's okay.
When they go to the vet every 6 months, they get, I guess, medicine for worming plus heartworm medicine.
Well, every year. He's only 7 months old right now, but on the year usually, or every 6 months, we make sure to take him to a vet, just get him checked out, do all his lab work and tests, make sure he's all healthy.
Heartworm, and he gets a monthly med that covers all the fleas and ticks and
That's not, since I don't know what it is.
No, I guess not, because he doesn't have them, so I don't need to protect myself.
Well, I make sure to always, if I'm cleaning him in those areas, I wash my hands after, make sure not to, make sure I'm not contracting anything that could be a variant of that part of his body system. So I'm making sure to, stay clear and clean.
I do wash my hands and don't touch my face type of thing. And other than that, I think, I vacuum a lot, make sure the house is clean. That's pretty much it. I think nothing else comes.
That Toxocara is a roundworm, so it's an intestinal worm, which is, if you're familiar with like a earthworm, possibly. Think much smaller, but lives in the guts of dogs and cats. So Toxocara cati is the species of Toxocara that infects cats, and Toxocara caninum is the species that infects dogs. And if your dog or cat has an active infection, those worms will shed the ova in their feces, and they can shed tens of thousands, if not hundreds of thousands of eggs per day per worm. And if those eggs get out into the environment from your dog or cat defecating, they will go through a maturation cycle, become larvinated. So you actually get a small worm inside of that egg. And if another dog or cat eats those eggs, so a little bit of poop, whether it's in the dirt or in some other kind of environmental matrix, they can start the cycle all over again, and they can become infected with Toxocara. For humans, the risk is right, any environmental matrix that has potentially contaminated with even minute amounts of dog or cat feces poses a risk for infection, whether through soil or through produce if you're not washing it completely. Anywhere there's a risk of you ingesting feces from dogs and cats poses a risk for Toxocara transmission.
See it a lot, almost daily. It's probably the most common intestinal parasite that we see in dogs and cats. Usually, when we see it, it is puppies and kittens in their early visits, usually the first visit prior to being dewormed. If it's not a puppy or a kitten, we tend to see them in dogs that maybe are strays or are primarily outside dogs. Distended abdomen, usually a lot of heavy worm burden in those patients. That's probably the number one thing. They can definitely have some diarrhea, occasionally vomiting. If it's severely affecting them, they can be really lethargic and not eating. Yeah, so if you get a young, again, puppy or kitten, there's a reasonable chance they've got them when you get them. For a adult dog, as far as prevention goes, I would always make sure to pick up after them after they go outside. If they dogs that are walked on leashes, as opposed to dogs that go off leash on walks and find things on the ground and get into stuff and pick up the parasites that way. Changing the litter box daily for cats. For dogs, picking up doggy bags after they defecate outside, making sure it's limited in the environment, and just making sure you're washing your hands. Just kind of standard hygiene.
In terms of individual cases, we do actually see children on a fairly regular basis with Toxocara. For the cases of children who are referred to us for evaluation, symptoms can be quite varied. You actually can have patients who present with sort of non-specific symptomatology, and their pediatrician will grab a CBC and they see a pronounced eosinophilia, and then they get referred to us, and then there can be sort of varied manifestations of the disease. Most recent NHANES study found a nationwide seroprevalence of about 5%. I think it's important as people, interact with animals in a one world health context, that I think it's important for so many diseases, not just Toxocara, but to make sure that one's animals are dewormed. So in the particular case of Toxocara, we really want to make sure that if you have a pet dog or cat, that they are dewormed. Also, you want to make sure, of course, that one is washing one's hands as thoroughly as possible after coming into contact with any with any animal, of course, but in the case of Toxocara with dogs or cats.
I'd say maybe the rising threat is that some helminth infections of dogs and cats are evolving to become resistant to some of the medication that we're giving them. So there's a lot of critical research going on now to better understand how can we continue to effectively deworm our pets, to make sure that when we are giving the medication, it's actually killing all of the worms and intestinal parasites, and that if they are evolving to be resistant, that we're still finding ways to make sure that we're reducing the transmission of these pathogens in the environment, and also keeping our pets happy, healthy, and safe.